Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. All right, George, tell me what's going on with your knee, your foot, your left knee and
Okay,
foot.
in December of 2017, I had a knee surgery that was very invasive, where they had to remove my ACL ligament.
And this knee?
And this knee, yeah. The reason they had to remove the ACL ligament is in 2010, a surgeon did an ACL reconstruction and put the cadaver in wrong. He drilled the holes in the bone wrong. So 2 MRIs.
2010, you said?
2010, yeah.
Oh, wow.
And I had problems with it ever since. So in 2017, I went to another orthopedic surgeon, the surgeons for the Indianapolis Colts, and they did 2 MRIs, and 2 different radiologists said that the cadaver, the ACL, was in wrong. So they removed it. So since they removed it, I'm walking better. I don't have an ACL, but I've had nerve damage, and my IT band is very tight all the way down, and then the top of my foot, it hurts really bad, and then the bottom of my foot.
So how much pain do you feel there from 0 to 10, and where do you feel it?
I feel it on the top of my foot, all up way up into my ankle, and then through my toes, and it's constant 24 hours a day, like a 5. And there's times when it's an 8. Well, when I was able, about a month after, when I was able to get through the pain in my knee, I could start feeling, the nerve damage from the surgery.
What kind of pain? Sharp, dull, aching, tingling?
Aching in the middle of the night, and aching so bad it will wake me up. And then there's definitely tingling, and then numbness.
Numbness, and all that's most of your pain concentrated on the top of your foot.
The top of my foot, and then inside the ball, inside this area.
In that area.
And I've tried stretching it, rolling it, ceramic wheels.
Oh wow.
Yeah.
Okay, don't do that at home. Yeah.
Like plantar fasciitis tools I've tried to do.
You tried that. Yeah. So December, we currently in October 2018, so it's about 10 months or 11 months. So what type of treatment you had before coming here?
I've had chiropractic, where they said something was out in my hips. Caused my foot pain. Okay. So they tried to straighten out my hips. Okay. Then I had massage therapy from numerous different massage therapists on my feet and my ankles. And one said it's because my shins were so tight, and that the IT band was causing that tightness down there. So they would work in it with their fingers and really dig in really hard.
So you had chiropractor, you had massage. What else? You had physical therapy?
Not on the foot. Haven't. Okay. Yeah. They said it would go away after time on its own. So they didn't give me physical therapy on the foot itself. Okay. I had physical therapy on the knee
after the surgery.
Yeah, but that didn't help my foot.
Okay. So can you give me a little bit like what's going on with your knee now? How much pain? What's difficult for you to do?
Okay. So this is counterintuitive, but without the ACL, I'm able to move my knee. And I've been able to ride my bike and jog and run, but very carefully, because I don't have an ACL ligament. Okay. So I've got range of motion, and I don't have much pain in it, but my leg has gone out on me where I was going downhill.
Like gave out, yeah.
It gave out, and I fell down one time in the landscaping,
and
I
gotta
tore
be
it all
careful.
up.
Yeah, okay.
Because I don't have an ACL, so I'm dealing with that. But mostly, the IT band that goes up to my hip is what's causing it. It's like a rod in my leg, and you can feel it.
And that's since 2017 or before that you have,
Yeah,
so you feel tightness in your IT band.
Yeah.
Okay. All right. Any other treatment you had? Anything else we need to know about this?
Just pain pills. I went to a pain clinic.
Okay.
For
so pain management. Okay.
That did not work for me.
So I want to know, like, I know you told me you have like a constant pain, like how much, 5 to 6 or something like that?
My foot, like
your foot.
Yeah, okay. It's a constant 24 hours a day.
24 hours.
Oh yeah.
I want to do a motion that actually stimulates your pain. To use that for testing. I know you have pain currently, but I want to see that motion. So when we do the treatment, we can retest it again.
Okay.
So what aggravates your symptoms? Standing, walking?
Standing.
Okay.
But walking, every time I bend my foot up like this to take another step. So when I take a step and my foot goes up, I feel it. I feel it right in here.
Okay.
So I take a step here and then right there.
How much from 0 to 10?
It's 6, 7, 8.
Okay. So
9,
when you do like heel raises.
And I don't because they hurt like right there. I'm not even. I'm on one foot, but if I do one, yeah, it's. I can do it, but I'm about to grit my teeth.
Okay. How much from 0 to 10?
It goes up to a 9.
Okay. One more time. I want to see how much pain and give me the number.
Okay. So there's let's just 6 and 7.
Okay. Don't fall. Okay.
8, 9. 9.5. Yeah.
Okay, don't push it. Okay. All right. So it's just a few seconds and you feel that. So we're gonna use that for testing. Okay.
And then when I go downstairs, anytime there's impact like this, I'm not hitting it. That tap.
Tapping like this.
So just tap like that. Tap. It's pain. It goes up, shoots up my leg, and it starts going numb. Just tapping.
That tapping.
And I'm barely touching. I'm just tapping.
Oh, okay. Numbness. How much from 0 to 10?
That goes up to about 7, 8.
So we're going to use that tapping and we're going to use the hair raises to see how you respond to the treatment.
And more. There's tightness in there, but I'm not feeling the pain. I just feel tightness.
What I know you're going to continue feeling tightness because there's a lot more work to do. What I care now is the constant numbness you used to feel and the pain. And
I feel pain now. I feel pressure, but not as much pressure. It's moving better.
Okay, so that's your foot. Okay, what about your knee?
Oh, the knee doesn't hurt, but I mean, this area here is better. It used to be I would just touch it and tap it, and it would just go through my knee. But
so any pain now?
Much better.
Any pain or gone?
Hard to believe. I thought that would hurt.
Yeah, that's good.
I'm pushing really hard on it, and I may have a 1.5.
That's not bad.
I have like nothing there. I mean, look how hard I'm pushing.
Yeah.
I probably created about a 2. With.
I don't want you to aggravate it. You might have some inflammation. We're gonna work on the inflammation. There's still some work I need to do here.
I mean, like maybe a 1 right there. So.
Okay. So the constant pain. 0 to 10. Foot and like knee and foot.
Constant pain?
Yeah.
I don't have any.
Okay, so let's do the other test for the tapping and the heel raises. Because you said your pain was like from 7, the constant pain going to 8 and 9 with that. So I want to know how does that feel?
Actually, this foot is tighter than that one.
Okay.
That does not hurt.
Okay.
I mean, I feel it because it's a tap, but I would say when I tap it, it's maybe a 1.5.
Not bad. Okay.
I don't remember the number.
You were clenching actually before. I tried to get your whole body before.
I felt that.
Yeah.
So this is something I did before, going up on there, and that probably goes up to like right there. Right there is putting me at about a 5.
Where?
Up that high right there. That's extended about as far as I can.
5 where you feel the pain.
The pain. In my big toe and the whole ball of my foot. I'll show you.
Okay.
So when I go up that high, which is high as I can go, I feel it. This whole area right here.
Okay.
That whole area there.
Like
let me just try with this foot to see if I get much. You know what? They're about the same. This foot, this leg did not have surgery, and I feel it there too.
That's a plantar fasciitis for both of them. Okay.
That's the same pain I have, yeah. But I don't have it the other.
Well, we're not working on the right. Let's focus on the left, the side we're working on now. So you feel it like 5 now because I'm gonna do more work and we'll come back.
As far as I can go.
Yeah.
It was a 9 to 10.
Well, I'm getting your face now. You're not really doing this.
My teeth off. Yeah.
Yep.
I hope so.
Okay. What about now?
I'm okay with that.
Okay. I'm gonna increase it gradually.
Okay.
Give me feedback.
That'll probably help if you do it gradual.
What about?
I'm okay.
Okay. Is it painful? It's okay.
Yeah, I'm good.
Mm-hmm. Sorry. Mm-hmm. How about that?
Okay.
Okay.
That's okay.
We'll do the same thing again. Tapping.
Yeah, that's improved. I'm actually, before I was just touching it, now I'm actually pushing it down.
Yeah, beautiful.
Okay.
Yeah. How's that?
There's some pain on the right side of the outside of the toe, but I'm now pushing that.
0 to 10?
Like a 2.
Not bad, actually. Not bad. I'm not expecting it gonna be to 0 because you have some inflammation. But 2 is not bad, actually. I'm happy with that.
It's been that way for 20 plus years.
Yeah.
So
20 plus years, how much pain you had it there before we start working on it?
Oh, it was 8, 9. I mean, when I get off work, I didn't want to do anything. I just get through the work day, and if my feet don't hurt, I would want to keep doing things.
Yeah. All right, that's good. Yeah. How does that feel? You're really doing a lot now.
I know, and I'm.
Are you trying to show off here?
Yeah, I'm showing off because
beautiful,
it's working so much better.
Yeah,
so,
yeah, that's beautiful.
Thank you very much.
Here. So, what do you think about ASTR treatment? So,
I'm a believer. I don't think I'll let anyone else touch me. Other than this ASTR treatment. So I've tried everything else.
Yeah, awesome.
That doesn't hurt near as bad as those needles. The
acupuncture you had.
Yeah, I've done that too. So.
Yeah, awesome. Thank you.
Thank you.
Yeah, awesome. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to astrinstitute.com.